Today we are talking tobacco as the World Health Organization estimates 22% of the world population uses tobacco. We're going to look at the effects of smoking in our state, the country, and really all around the world. So let's dig into it. We're going to start right here at home in North Carolina. The State Department of Health and Human Services recently released a report. It says that people in our state who struggle with mental health or heavy drinking are using tobacco less. It is the lowest rate in more than a decade. It's part of the Breathe Easy NC campaign. This is data from the campaign that says smoking is on the decline statewide. Tobacco is the #1 preventable death in the state. The campaign hopes to fix that. Even if you stopped smoking a long time ago or used to live with someone who smoked, you might still be at risk for lung cancer. And that's why one cancer survivor we talked with says that everyone should get tested.
Lung cancer screening, it is the deadliest kept secret. And rather than, finger wagging or shaming somebody who has a history of smoking, it would be so much better if you just share information in love about lung cancer screening.
Doctors say the process for that lung cancer screening is easy and so very worth it.
You lay on your back. You put your arms over your head, you take a deep breath and hold it for 10 seconds. You're in and out of the scanner in 5 to 10 minutes. No dye, no injection, no IV. It is quick, it is easy, and it is very impactful.
Early cancer screening certainly helped one person that we talked to, Regina Duff. She smoked for 30 years. Here's how one CT scan saved her life.
At 18 years old,
everybody else doing it, and I just started doing it myself.
Regina Duff picked up her first cigarette.
My big sister, she smoked, so I'm following after her.
She says it helped her relieve stress, and she got used to it until it eventually became a habit.
Every 15 minutes, I smoked maybe a pack a day. I did. I smoked for 30 years.
The thought of smoking's impact on her health didn't cross her mind until she turned 54.
And I started having problems breathing.
Her primary physician suggested she stop smoking, but she didn't.
When you get up in the morning, that's the first thing you want to do is smoke a cigarette. You know what I'm saying? After you eat, you want to smoke a cigarette.
Because of this decision, she had trouble breathing again and landed in a hospital for 2 months. The doctor there told her to get a CT scan due to her history.
I had the CT scan done, and then it came back to a very little spot.
This spot was found on her lungs. Dr. Bradley Eichert, a pulmonary critical care physician at Cone Health, reviewed the scan.
After coming to the decision that her nodule looked like a lung cancer, I told her that we was going to reach out to one of my colleagues, Dr. Lightfoot.
Good to see you. How have you been?
All in the same day, Duff was wheeled into another room to meet Dr. Harold Lightfoot, a surgeon who helped remove the spot.
After the surgery, patients usually stay in the hospital 2 to 4 days. There are some patients that go home the day after surgery if everything looks good.
No radiation and no chemotherapy.
I'm so glad to see you doing well.
Duff is now cancer-free thanks to early detection.
I'm just grateful because that's the one thing I was very scared of when he told me I had cancer, is that I would not see my oldest son get married.
Most lung cancers are actually diagnosed asymptomatic, and that's why screening is so important.
Duff lives a more healthier life these days.
I walk my dog. I have 3 granddaughters. My son just got married.
And encourages others who are finding it difficult to stop smoking to get screened too.
If you could get a CT scan done early, please do, because that's what saved my life. That's what really saved my life.
We're so glad she can talk about it. Now, while there is progress, tobacco is still one of the biggest health threats to our country. The CDC reports nearly 30 million Americans smoke, and another 16 million live with a smoking-related disease. The situation around the world is not much better.
Tobacco use continues to be one of the biggest public health threats, with 8.7 million people dying from tobacco-related diseases every year.
Another million non-smokers also die yearly from secondhand smoke, but the World Health Organization says there's progress on that as well. A 5% drop in the number of smokers over the last 20 years. They use strategies like smoking education, helping people quit, and tobacco taxes to keep the number of smokers down. The WHO says roughly 70% of the world's population is now protected by at least one of these kinds of measures. Many younger people have ditched cigarettes in favor of another harmful addiction, that would be vaping. They don't contain any tobacco, but they do have nicotine, and the substance that makes smoking so very hard to quit. The CDC says nicotine hinders brain development in young people, causing a loss of control in attention, mood, and learning. One health expert says the early exposure to nicotine can cause problems down the road.
Introducing any type of chemical to the brain that really shouldn't be there, like nicotine, can set a person up for an addiction with that chemical, or potentially others, that are even worse.
The U.S. Substance Abuse and Mental Health Services says 5 million high school students say that they have vaped. Experts say it's not too early to have a conversation about addiction with your kids.
You can have substance abuse conversations as early as pre-K and kindergarten. It can start with conversations around medications, how to take them the right way.
One country decided that enough was just enough, and they banned people from buying tobacco products for life. Back in December, on the other side of the world, New Zealand passed a law preventing tobacco from being sold to anyone born in 2009 or later. Their goal is to make the island country completely tobacco-free. It's an interesting strategy, but they say they've already seen success with anti-tobacco policies in the past. Since 2000, the number of New Zealanders smoking has been cut in half. That is Dig Into It. If you want to quit tobacco or vaping, you can visit quitnc.com for free help.